Let me tell you about a patient I saw recently. So this is a woman who is in her 40s, who is overall healthy, has 2 kids, has a busy life because she's a professional. However, she came in frustrated and said, "Dr. Noor, I'm tired of getting these urinary tract infections, and I always feel like I'm never emptying my bladder properly. I'm always running to the bathroom every few hours. And sometimes I even have to push to make the urine come out when there's this constant pressure and heaviness that I feel." She had been treated multiple times with antibiotics for her urinary tract infections, but the frustrating part is no matter how much she treats it with antibiotics, the infections keep coming back and back. After listening to her story, when I examined her, we realized that the problem was not really her bladder infection, but instead she had bladder prolapse, often known as a cystocele. And once we treated that, voila, her symptoms are so much better. Hi everyone, I'm Dr. Nabila Noor, a board-certified and fellowship-trained urogynecologist and a pelvic reconstructive surgeon, and welcome back to my pelvic health channel, where I talk about everything to do with women's pelvic health. Why does it happen? What are some causes? And what can you do about it? If you're new to the channel, welcome. Hope you like what you see, and if you do, please don't forget to hit the subscribe button so you can continue to learn with us every week. Today is going to be part 1 of our pelvic organ prolapse series because, believe it or not, pelvic organ prolapse can be different for different patients. So I want to talk to you about the various different kinds of pelvic organ prolapse. So today we're going to start with cystocele, also known as an anterior vaginal wall prolapse. So before we talk about prolapse, I want to show you some anatomy. So this is a female pelvis. This is the external part of the female genitalia. And this is known as the bony pelvis. And inside this pelvis is where we have all our pelvic organs, which could be the uterus, the bladder, the rectum, the intestines. Now, all these pelvic organs right here are supported by our pelvic floor muscles, which essentially forms the base of our torso. Now, prolapse happens when these pelvic floor muscles are weak and not doing a good job supporting all the pelvic organs that's sitting inside of it. And why does your pelvic floor muscles not support your pelvic organs correctly? There could be a whole host of reasons. Most commonly could be pregnancy, childbirth-related trauma, being overweight, chronic constipation, chronic cough, genetics. Anything that puts a lot of pressure on your pelvic floor can over time make those pelvic floor muscles get weak, and as a result, all the pelvic organ prolapse can push through. Now, as mentioned, today's topic is all about cystocele, so I'm going to show you what a cystocele looks like when you look at the organs. So for orientation, this right here is the vaginal canal. Imagine this is the outside of the body, this is the outside opening of the vagina. So the vagina is like a cylinder. The top part of the vagina is known as the anterior wall of the vagina. The back part of the vagina is known as the posterior wall, and on top of the vagina is where you have the uterus, and here are the tubes and the ovaries. Now the uterus is where you have a baby when you're pregnant, and the tip of the uterus, which is right here, is known as the cervix. Now the bladder, which is the organ that holds our urine, sits right on top of that anterior vaginal wall. So cystocele, which we call bladder prolapse, happens when the support structures that's supposed to hold the bladder in place is not working as well. As a result, what happens is the bladder is pushing into that top vaginal wall and can cause that top vaginal wall to protrude out of the vaginal opening almost like a little balloon. Yes, a cystocele means the bladder is dropping, but it's not that the bladder is coming out through the vagina because there's no hole in the vaginal wall, right? But what it can do is push that vaginal wall. So what's actually protruding like a little ball is your vaginal wall, with the bladder being on the other side. Because a cystocele can distort your bladder, oftentimes women will complain about not being able to empty their bladder properly, and as a result they can get a lot of infections, which can be very difficult to clear because they're retaining their urine. And if the infection is not clearing up from down below, the infection can track up their ureters into their kidneys and can even cause infection of the kidneys, which is not a good situation to be in. And that is why, if you are somebody who has been diagnosed with cystocele and are having difficulty emptying your bladder and are suffering with recurrent urinary tract infections, meaning you're getting multiple infections, 2 or more in a 6-month period or 3 or more in a year period, then definitely talk to your doctor, get a referral to see your urogynecologist so we can do a thorough evaluation and talk to you about some treatment options. So some key things to know about a bladder prolapse or a cystocele or anterior vaginal wall prolapse. First thing to understand are the symptoms. So as I mentioned earlier, symptoms can be really different for different people. For some people, it could be difficulty emptying their bladder. For some people, it could be recurrent urinary tract infections. A lot of people can talk about feeling that pressure or heaviness, having to push into the vaginal wall to empty their bladder or even their bowel. Feeling a lot of urinary urgency, frequency, and feeling that the urine stream is very weak and not being able to empty their urine completely. All of these could be signs of your bladder prolapse. The good news is a cystocele is a very treatable condition. And not just with surgery, there are many non-surgical treatment options that can be really effective in treating your symptoms of prolapse and as a result improve some of the symptoms that we talked about. Starting with conservative treatments, things like pelvic floor exercises to strengthen your pelvic floor muscles, or using a pessary, which is a vaginal insert that can be put in the vagina to push the prolapse back and suspend the bladder to where it belongs. For those of you who want to know some detailed information about a pessary, definitely check out all the videos I have about pessaries. I'm sure you're going to learn a lot. Vaginal estrogens, especially for my patients who are menopausal or even in perimenopause, can help improve the tissue texture and can help strengthen your pelvic floor muscles as well. And finally, surgery. While surgery may sound scary, if the only thing you have is a bladder prolapse, many times we can do these surgeries vaginally without any incisions in your abdomen. These are 30 to 40 minute surgeries and patients can go home the same day and recovery can be really simple. So if you're somebody who has been told that you have a cystocele or a bladder prolapse and you're suffering with some of the symptoms I mentioned earlier, then don't be scared. Do see a specialist, preferably a urogynecologist, so we can do a thorough exam and talk to you about some specific treatment options to help your condition. Hope you found this video helpful and educational, and if you did, don't forget to hit the subscribe button and also definitely sign up for my newsletter. Every week I send you an update about what we've been doing with regards to education, and once a month I send you a detailed newsletter where I talk about some of the advances in our field, share with you some of the news articles, some evidence-based information, the cutting-edge research, and the best part, everything will be delivered right in your mailbox without you having to go anywhere to seek information. And don't forget to tune in next week because I'll be back with part 2 of our prolapse and we're going to learn about rectocele. So till then, stay well, stay healthy, and don't forget to take care of your pelvic health. Bye.